This is an instructional video on how to complete the calf circumference measurement. Calf circumference can be used as a marker of muscle mass in clinical practice. Calf circumference can be measured using a standard soft tape measure. If this is not available, a length of string or wool around 40 centimetres long and a ruler will be adequate. You can position the participant seated with legs bent at 90 degrees, thighs perpendicular to the floor and feet flat on the ground, or standing with legs apart and feet flat on the ground. Ask the participant to adjust or remove pants or long boots if covering the calf. We measure around the calf at the point where it is widest. You can find this point by moving the tape measure up and down without pressing into the subcutaneous tissue too much. Hold the zero end of the tape below the measurement value. The tape should be snug but not too tight. Record all measurements to the nearest 1 millimetre. You will complete a total of 6 measurements, 3 on each side, alternating between the right and left sides. The maximal or largest calf circumference measure is used for analysis. The following cut points may indicate low muscle mass for patients with a BMI of 18.5 to 24.9. BMI adjusted calf circumference cut points are also available for patients with a BMI greater than 25. For more information on the calf circumference measurement, please see the how-to guide linked below.